Eating disorders are complex mental health conditions that can have serious physical and emotional consequences. In this presentation, we will delve into the intricacies of eating disorders, exploring their various types, causes, symptoms, and treatment options. By gaining a deeper understanding of these disorders, we can better support individuals affected by them and work towards promoting recovery and healing. Anorexia nervosa presents a formidable challenge, marked by an intense dread of weight gain, a skewed perception of body image, and a compulsive urge to restrict food intake. This disorder carries alarming mortality rates, often resulting from complications like sudden cardiac death or suicide. Individuals grappling with anorexia also face heightened risks of developing comorbid conditions such as depression and obsessive-compulsive disorder, further complicating their prognosis. A pivotal determinant of anorexia's severity is the patient's body mass index, BMI, with lower BMIs signaling a more critical state. Anorexia may manifest in two subtypes: the binge-eating purging type, involving behaviors like vomiting, laxative abuse, or excessive exercise, and the restricting type characterized by strict food intake limitations. Anorexia nervosa inflicts a devastating toll on the body, precipitating a spectrum of physiological complications. These encompass electrolyte imbalances, such as hypokalemia, which can precipitate perilous heart rhythm irregularities. Patients may additionally contend with bradycardia, hypotension, and metabolic disruptions like alkalosis or acidosis, contingent on their specific behaviors. Individuals grappling with anorexia frequently wrestle with comorbid mental health conditions like depression, anxiety disorders, and obsessive-compulsive disorder, which can exacerbate the severity of the eating disorder and heighten the risk of suicidal ideation and attempts. The treatment of anorexia nervosa necessitates a multifaceted approach, often commencing with emergency hospitalization to tackle acute medical crises, succeeded by long-term psychotherapy like cognitive behavioral therapy, CBT, and sustained family support. In contrast to anorexia nervosa, individuals grappling with bulimia nervosa often maintain a normal body weight, rendering BMI-related concerns less clinically significant. Bulimia's hallmark diagnostic traits encompass binge-eating episodes succeeded by purging behaviors such as self-induced vomiting, laxative or diuretic abuse, or excessive exercise. Bulimia nervosa can precipitate an array of physical complications, including electrolyte imbalances, dehydration, esophageal damage, like Mallory-Weiss tears or Boerhaave syndrome, and dental erosion. Patients may also exhibit parotid gland enlargement and the characteristic Russell's sign, calluses on the back of the hands from recurrent vomiting. The treatment paradigm for bulimia nervosa typically integrates a blend of psychotherapy, notably cognitive behavioral therapy, CBT, and the utilization of selective serotonin reuptake inhibitors, SSRIs, to address the underlying psychological and neurobiological facets contributing to the disorder. Individuals grappling with anorexia nervosa endure an intense dread of weight gain and a skewed body image, driving them to extreme self-starvation and consequential weight loss. This condition is typified by a low body mass index, BMI, and often coexists with mental health comorbidities like depression and OCD. In contrast, individuals afflicted by bulimia nervosa maintain a normal or occasionally overweight body mass, but cycle through binge-eating episodes and purging behaviors, including self-induced vomiting, laxative or diuretic abuse, and excessive exercise. Bulimia frequently gives rise to physical complications like dental erosion and enlargement of salivary glands. Although both anorexia and bulimia share traits such as a distorted body image and an obsession with weight and shape, their primary divergence lies in patients' weight status and the specific methods employed to manage weight. Recognizing these distinctive features is pivotal for accurate diagnosis and the formulation of tailored treatment strategies. Body dysmorphic disorder, BDD, manifests as an obsessive fixation on a perceived flaw or defect in one's physical appearance, often centered around the face or head. Those with BDD endure profound distress and resort to compulsive behaviors, like excessive grooming or pursuing cosmetic procedures, in attempts to rectify their imagined imperfections. This fixation on perceived physical flaws can severely disrupt daily functioning, strain social bonds, and diminish overall quality of life. BDD frequently co-occurs with other mental health disorders, including depression, anxiety, and obsessive-compulsive disorder, compounding the individual's challenges. Effective management of BDD typically entails a blend of cognitive behavioral therapy, CBT, and pharmacological interventions, like selective serotonin reuptake inhibitors, SSRIs. The objective is to assist the individual in cultivating a more realistic and balanced self-perception while addressing the compulsive behaviors intertwined with the disorder. Anorexia nervosa manifests in two primary subtypes. The restricting type entails severe food limitation, often coupled with excessive exercise, devoid of binge eating or purging episodes. Conversely, the binge eating purging type involves cycles of restriction, binge eating, and subsequent purging behaviors like self-induced vomiting or laxative abuse. Similarly, bulimia nervosa delineates into distinct subtypes. The non-purging subtype comprises compensatory behaviors such as fasting or excessive exercise without purging. In contrast, the purging type entails binge eating, followed by purging behaviors like self-induced vomiting or laxative misuse to counteract the binge's effects. Understanding these subtypes is pivotal for accurate diagnosis and tailored treatment approaches. Eating disorders frequently coexist with various mental health conditions like depression, anxiety disorders, and obsessive-compulsive disorder, OCD. These comorbidities not only intensify the eating disorder's severity, but also affect the individual's prognosis. The relationship between eating disorders and mental health conditions is complex and bidirectional. For instance, someone with an eating disorder may develop depression due to the disorder's physical and psychological toll. Conversely, pre-existing depression may contribute to the onset or exacerbation of an eating disorder. Effectively addressing eating disorders necessitates acknowledging and managing this intricate interplay with comorbid mental health conditions. It often entails a comprehensive approach involving psychotherapy, such as cognitive behavioral therapy, CBT, appropriate pharmacological treatments, and ongoing support for both the individual and their family. In anorexia nervosa, physiological complications such as hypokalemia and metabolic disturbances can occur, leading to significant health risks. Cardiac complications, including bradycardia, arrhythmia, and hypotension, pose serious threats to individuals with anorexia nervosa. Endocrine issues such as amenorrhea are common, impacting reproductive health. Additionally, anorexia nervosa can result in musculoskeletal complications like osteopenia, osteoporosis, and myalgia. Similarly, individuals with bulimia nervosa face physiological challenges such as hypokalemia and metabolic disturbances, which can disrupt normal bodily functions. Cardiac complications, including arrhythmia and hypotension, are notable risks associated with bulimia nervosa. Gastrointestinal issues such as esophagitis, Mallory-Weiss tears, and Boerhaave syndrome can arise from purging behaviors. Dental complications like dental erosion and caries are also prevalent. Furthermore, bulimia nervosa can lead to endocrine complications such as irregular menstrual cycles, affecting hormonal balance and reproductive health. Eating disorders, when left untreated or unmanaged, can have severe and enduring health consequences, including organ damage, bone loss, and cardiovascular issues. These physical complications may persist even after recovery, underscoring the critical need for early intervention and sustained treatment. The psychological ramifications of eating disorders can be equally profound, with individuals often contending with anxiety, depression, and obsessive compulsive tendencies. These concurrent mental health conditions can exacerbate an individual's distress and hinder the recovery journey. Despite the significant challenges posed by eating disorders, recovery is possible with the appropriate support and intervention. Through a multidisciplinary approach that addresses both the physical and psychological facets of the disorder, individuals can work towards restoring their health, rebuilding their lives, and cultivating resilience and well-being. Recognizing the signs and symptoms of eating disorders early on is paramount, as it enables prompt intervention and maximizes the likelihood of successful treatment outcomes. Healthcare providers, educators, and support networks must remain vigilant in identifying potential red flags, such as abrupt weight changes, alterations in eating behaviors, and obsessive fixations on body image. Upon suspicion of an eating disorder, a comprehensive evaluation by a multidisciplinary team becomes imperative. This team typically comprises mental health specialists, nutrition experts, and medical professionals. Through this assessment, the specific type and severity of the disorder can be determined, along with any underlying or accompanying conditions exacerbating the individual's challenges. Subsequently, a tailored treatment plan can be devised, integrating evidence-based interventions such as cognitive behavioral therapy, CBT, family-centered approaches, and in cases of acute physical complications, medical interventions. The overarching objective is to address the disorder holistically, equipping the individual with the necessary support and strategies to foster enduring recovery. Family and loved ones serve as linchpins in the journey of individuals battling eating disorders, wielding significant influence in the treatment and recovery trajectory. Their active participation in therapeutic endeavors, provision of unwavering emotional sustenance, and facilitation of constructive routines and coping mechanisms can markedly enhance the prospects of successful recuperation and enduring wellness. Beyond familial support, the availability of community resources emerges as a pivotal asset for individuals grappling with eating disorders. Support groups, educational initiatives, and specialized treatment facilities furnish not only essential clinical interventions, but also foster a sense of community and alleviate the profound isolation often entrenched in these disorders' struggles. Moreover, heightened public awareness and advocacy endeavors constitute indispensable components of the support ecosystem for affected individuals. By challenging societal norms and dismantling stigmas, advocating for enhanced access to treatment, and advancing educational initiatives, communities can cultivate a more empathetic and supportive milieu conducive to navigating the arduous path toward recovery.